Deaf Connect has partnered with Central Adelaide Local Health Network, CALHN, to provide better health outcomes for the deaf community. We're breaking down the barriers for the deaf and hard of hearing community.
We know that the deaf and hard of hearing community faces challenges when it comes to accessing healthcare globally. We also understand that medical teams are doing the best they can in an often high-pressure environment. And this has only been exacerbated in recent years by COVID-19.
We worked with two different focus groups from the deaf community and CALHN healthcare staff. This was to identify the gaps in services and communication and how healthcare staff can improve their care for the deaf and hard of hearing community. The feedback from the focus groups gave us a better understanding of how to provide the appropriate training. This training helps provide healthcare staff with a better understanding around communication needs and providing patient care, which also reduces risk for staff and patients. The training is successfully removing barriers to the equitable access of healthcare, so staff can provide better care for the community.
At CALHN, it's extremely important for our workforce to be able to effectively communicate with the deaf and hard of hearing community. If you need to access our services or come to hospital, we want you to be able to understand the health information and be able to make informed decisions about your care.
I found the online training through Learning Central so helpful. I can see the vision from our focus groups come to life in that training module. It's essential for all of our staff to get involved and make our hospitals a more welcoming and inclusive place for the deaf and hard of hearing community.